Nick Majerison here. Time now for a conference highlight. It's Dr. Steve Flanagan, Chair of Physical Medicine and Rehabilitation at New York University, and Colleen Walsh, the Assistant Professor of Nursing at the University of Southern Indiana, and the President of the National Association of Orthopaedic Nurses. They're joining Desiree Chappell on Top Med Talk in association with the Roundtable Perioperative Care blog. Have a listen.
Top Med Talk.
We hear a lot about prehabilitation and post-habilitation, that coining the new phrase when it comes to enhanced recovery and care pathways. And I'm interested to hear what your experience has been with the preoperative optimization part of this and prehabilitation, as well as, Colleen, you're actually speaking today about early mobilization and rehabilitation post-operatively. So have you had experience with that, Dr. Flanagan?
Well, sure. One of the nice things where I work at NYU Langone is that we're able to really provide care in a setting where we're all working together. So our orthopedic center, for instance, has physical therapists, physiatrists, rheumatologists, and orthopedists. So the orthopedist plans surgery and sends them right down to physical therapy to start working on plans for improving strength even before the operation. And that has been actually very successful.
So as far as post-habilitation or rehabilitation, Dr. Flanagan, you've mentioned several times about that the patient may actually start receiving their post-habilitation in the recovery room. Final comments on, and Colleen, if you can speak to this, the importance of early mobilization in post-op joint care.
Like I said to myself when Zeev gave me this topic, it's like I'm singing to the choir because this is what we're all about. And, all the research just so supports that whole thing. The other issue is that if the patient's out of the bed, the patient doesn't get into that sick roll. They just don't, laying with the wet washcloth on their forehead. We've all seen that.
Absolutely.
That wet washcloth syndrome is not a good thing. As soon as they're out of the bed, they're out of that sick role and into the active role. And I think that part of that psychology that we talked about earlier, that's really a key piece. It's another buy-in piece and gives the patient more control.
Yeah, and one of those things that we may not actually be able to quantify as a benefit to early mobilization too.
Top Med Talk.
And don't forget, you can meet the Top Med Talk team. All you need to do is turn up at one of our events. Check out ebpom.org for more details. ebpom.org.